Good morning, wherever you are. This is Benji Cross from ConferenceHype. Our segment will focus on recipient endothelial IRF1 mediates if and gamma-driven tissue tolerance in mouse models of acute graft versus host disease. From the 2026 August 6 edition of Blood. Background: antigen-specific T-cell immunotherapies are transforming the treatment landscape of hematologic malignancies. Methods: neoantigen-specific therapies that exploit the ability of endogenous T-cell receptors to recognize tumor-derived peptides in an HLA-restricted context differ mechanistically from modalities employing chimeric antigen receptor T-cells, which target surface antigens in an HLA-independent manner. Results: in contrast to approaches targeting tumor-associated antigens, neoantigen-specific strategies offer more precise tumor selectivity and reduced off-target toxicity. Discussion: emphasis is placed on identifying biological and technological barriers that limit the therapeutic efficacy of neoantigen-specific immunotherapies, with the goal of distilling actionable insights to guide their development in hematologic malignancies. From the 2026 August 6 edition of Blood. Background: T-cell acute lymphoblastic leukemia is an aggressive hematological malignancy arising from the neoplastic transformation of immature T-cells during their development in the thymus. Methods: deciphering the developmental programs whose dysregulation drives T-all pathogenesis is critical for the development of novel targeted therapies, which remain an urgent unmet need for the treatment of this disease. Results: microRNAs have emerged as key post-transcriptional regulators of numerous physiological processes, including cancer. Discussion: overall, these findings support a novel tumor-suppressive function for MER15B16-2 in T-all and highlight its potential as a promising therapeutic target. From the 2026 August 6 edition of Blood. Background: talquetamab is the first and only approved bispecific antibody targeting G-protein-coupled receptor class C group 5-member D for treatment of relapsed refractory multiple myeloma based on results from the Phase 1/2 Monument TAL1 study. Methods: patients naive to T-cell redirection therapy receive talquetamab 0.4 mg/kg weekly or 0.8 mg/kg every other week. A separate cohort received prior TCR. Results: median follow-up was 38, 31, and 30 months in the three cohorts, respectively, as of September 2024. Discussion: NCT 03399799 and NCT 04634552. From the 2026 August 6 edition of Blood. Background: ex vivo expansion of human hematopoietic stem cells holds promise for overcoming their limited availability, a major barrier to broader clinical application. Methods: although recent advances in culture systems can increase HSC numbers, these conditions frequently impair self-renewal and induce myeloid bias, and the underlying molecular mechanisms remain poorly understood. Results: our analyses revealed reduced transcriptional and epigenetic HSC signatures, accompanied by markedly increased activity of myeloid-associated transcription factor motifs, providing molecular insight into the functional decline and myeloid bias of cultured HSCs. Discussion: together, these findings elucidate molecular mechanisms underlying culture-induced HSC dysfunction and establish a niche mimetic strategy for expanding functional human long-term HSCs while preserving key features of stemness. From the 2026 August 6 edition of Blood. Background: the protein-protein interaction between menin and KMT2A plays a critical role in acute leukemia with KMT2A rearrangements, nucleophosmin-1 mutations, and nucleoporin 98 rearrangements, and represents an emerging opportunity for therapeutic intervention. Methods here. We report the development and comprehensive evaluation of the activity of ziftomenib as an orally bioavailable, highly potent, and selective small molecule inhibitor of the menin-KMT2A interaction. Results in leukemia cells and primary patient samples with the menin-KMT2A dependency. Ziftomenib profoundly inhibited proliferation, reduced clonogenic potential, and induced differentiation, which was associated with strong downregulation of the menin-KMT2A target genes, including MEIS1, HOXA9, and HOXB2. Discussion: ziftomenib has recently received U.S. Food and Drug Administration approval for adult patients with NPM1 mutated acute myeloid leukemia and continues to be evaluated clinically in leukemias with NPM1 or KMT2A alterations, both as monotherapy and in combinations. From the 2026 August 6 edition of Blood. Background: chimeric antigen receptor T-cell therapies have transformed the treatment of B-cell malignancies, yet challenges including manufacturing delays, T-cell exhaustion, and limited persistence impede broader clinical success. Methods here. We report the single-day production of non-activated CAR T-cells engineered to secrete interleukin-18, a pro-inflammatory cytokine that enhances T-cell function. Results: IL-18 expression enhances the functional advantages of naive-like non-activated CAR T-cells, resulting in improved persistence, metabolic fitness, and resistance to exhaustion. Discussion: this IL-18 enhanced, activation-free CAR T-cell product offers a clinically actionable platform with the potential to reduce vein-to-vein time while improving product potency and persistence, providing a rationale for clinical testing in patients with tumors refractory to standard CAR T-cell therapy. From the 2026 August 4 edition of Blood. Background: germline gain-of-function mutations in the signal transducer and activator of transcription. One gene cause a dominantly inherited inborn error of immunity characterized by chronic mucocutaneous candidiasis, autoimmunity, severe opportunistic infections, and an increased risk of malignancy. Methods to develop a curative, autologous alternative to HSCT. We evaluated gene editing strategies in STAT1 GOF model cell lines, primary T cells, and patient-derived HSCs. Results: germline gain-of-function mutations in the signal transducer and activator of transcription. One gene cause a dominantly inherited inborn error of immunity characterized by chronic mucocutaneous candidiasis, autoimmunity, severe opportunistic infections, and an increased risk of malignancy. Discussion: this represents the first application of gene editing to correct a dominant gain-of-function mutation causing immunodeficiency, with potential applicability to other genetic disorders associated with heterozygous and gain-of-function mutations. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 3 edition of Blood. Background: mitochondrial dynamics is a key regulator of cellular homeostasis, orchestrating metabolic reprogramming that fuels tumor progression and treatment resistance. Methods: in multiple myeloma, however, the functional relevance of mitochondrial remodeling has not been fully defined. Results: using ultrastructural analyses, we reveal that cells display a highly fragmented mitochondrial network, a phenotype further exacerbated in both cell lines and primary cells resistant to proteasome inhibitors. Discussion: altogether, these findings establish aberrant mitochondrial fission as a pathogenic hallmark of and highlight DRP1 inhibition as a promising therapeutic approach, especially for relapsed or refractory disease. From the 2026 August 4 edition of Blood. Background: acute myeloid leukemia is an aggressive blood cancer with a 5-year overall survival rate of 30%. Methods: although immunotherapies engaging T cells demonstrate remarkable success in treating many solid tumors and blood cancers, they show little to no efficacy in treating AML. Results: in addition, TQ treatment significantly reprogrammed transcriptome and epigenetic landscape of T cells, activated STAT1 signaling, and upregulated genes and pathways, promoting activation, survival, and cytotoxicity of CD4 and CD8 T cells. Discussion: our findings suggest that the dual actions of TQ on NIML and T cells enhance leukemia recognition and anti-leukemia killing of endogenous T cells, leading to effective AML clearance. From the 2026 August 6 edition of Blood. Background: drug resistance is a major challenge in cancer therapy, especially in hematologic malignancies, in which kinase inhibitors have transformed treatment yet are frequently undermined by drug resistance. Methods: although targeted protein degradation offers a mechanistically distinct mode of action compared with inhibition-based therapeutic therapies, the potential value of TPD in drug-resistant blood cancer remains unclear. Results: here, we report the discovery of cereblin recruiting molecular glue degraders targeting lymphocyte-specific tyrosine kinase, an oncogenic kinase in T-cell acute lymphoblastic leukemia. Discussion: taken together, our data highlight the potential of LCK targeting MGDs as a strategy to overcome kinase inhibitor resistance in TOL, offering a framework for targeting kinase dependencies in drug-refractory hematologic malignancies more broadly. From the 2026 August 6 edition of Blood. Background: patients with relapsed refractory mantle cell lymphoma, especially those progressing after Bruton tyrosine kinase inhibitor and/or chimeric antigen receptor T-cell therapy, and those with high-risk features, have poor outcomes. Methods: the bispecific antibody, mosunetuzumab, combined with the antibody-drug conjugate, polatuzumab vedotin, targets CD20 and CD79 via independent cell-killing mechanisms. Results: a total of 42 patients with a median of 3 previous therapies were enrolled. 26% had previous CAR T-cell therapy. Discussion: this trial was registered as NCT 03671018. That's it for now for ConferenceHype's coverage of the August 2026 issue of Blood. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments. Share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.